morning. Today I will be sharing the process and findings of the development of a psychological intervention for primary school attendance problems through co-design workshops with parents and professionals. This research project is part of my PhD that is funded by the ARC within the Starting Well theme, and I'm supervised by Dr. Catherine Lester and Dr. Daniel Michelson. So the COVID-19 pandemic has caused widespread disruptions to education, and this has been particularly difficult for children with emotional difficulties and special educational needs. This has had a subsequent outcome of increased school attendance problems, particularly anxieties around attending school. The onset of school attendance problems are likely to occur in primary school, and although the importance of early intervention has been evidenced, there is yet to be a focus on support for primary school aged children in the UK. So this study aims to develop a new intervention specifically for families who are supporting their child with anxieties around attending school, taking into account the evolving COVID-19 context. So the steps to develop this intervention involve phase 1, gathering research on school attendance problems through reviewing literature, policy and interventions. Phase 2 was bringing together experiences of parents and professionals. This involved surveys with 29 parents and 19 professionals and interviews with 10 parents and 12 professionals. And this particularly looked at the factors of that were affecting school attendance problems within the context of COVID-19 and the supports that were available and the experiences of these supports, or perhaps the gaps for further supports. And phase 3, which we're talking about today, is building an intervention in a practical way. So this involves co-design workshops with 10 parents and 10 professionals. And then this will lead to a development of an intervention that will be tried out in the real world with a feasibility study at a future date. So each of these phases build upon each other, and it's important to say that phase 1 and phase 2, the findings from that really fed into phase 3, creating that foundation of what we proposed or what we started with when we talked with parents, and then we really listened and evolved and took their thoughts and ideas to develop it into something that was more practical and useful for them. So the objectives of the co-design workshop was to think about what should the intervention aim to change, what intervention components might work best, who should deliver the intervention, and how should the intervention be delivered. So those who took part in the workshops were parents, so we had 9 mothers and 1 father. They were all quite highly educated, but we did aim to recruit from a different range of household incomes, and their children were from so within the age bracket of 5 to 11, and mostly had fewer days absence but still experiencing anxieties about attending school. 2 of these children were eligible for free school meals, and 3 had additional learning needs such as autism, ADHD and anxiety. So we had 2 workshops with the parents, and this was followed by a workshop with the professionals, which involved 7 females and 1 male. The professionals were an educational psychologist. We had 4 head teachers. One of those was a deputy head teacher, 1 special educational needs coordinator, and 1 education mental health practitioner, and 1 education behaviour support and attendance officer. So we started with the first workshop, which was in person with 6 parents, and what we discussed with them kind of fed in and moulded through what, started that looking at what the intervention would look like, and then further feedback and further thoughts were gained from 4 other parents online. And then with educational professionals, we brought the parents' priorities, thoughts and ideas, and asked professionals to think about how we can implement this in a practical, real way in the real world. So to elicit these thoughts and this discussion, we asked parents to share previous helpful and unhelpful experiences, comment on drafts of the intervention model that was informed by the phase 1 and phase 2, consider the pros and cons. A lot of this was done through post-it notes and discussions, both online and in person. So firstly, looking at the results of what came from these discussions and the parents' ideas of what the intervention should aim to change and what the intervention should involve. So from the phase 1 and 2 findings, when we were looking from the interviews and the surveys, we found that you have the child who is experiencing anxiety about attending school, and then you have these two avenues of support of parent and school. And there was lots of parents feeling that they didn't have or weren't bad enough to receive support in how to support their child. So this pathway between parent and child is what we aim to focus on. But we still thought it's important to recognise that there is a pathway between school and child, and there are many impacts of school on a child that affects their school attendance problems. So even though the intervention isn't able to change these factors, it's still important to recognise that these will still be at play. And then there's also this indirect relationship between parent and school that can help or affect a child's anxiety about school. So firstly, looking at, we were asking parents, how can we help you support your child? So they suggested about having particularly practical strategies, so a toolkit, having practical ideas on how they could respond to their child's anxiety and distress. So things for specific anxieties about school, scenarios with high levels of behavioural anxiety and stress, so perhaps in the morning before school, school transitions, and building their child's confidence. And these ideas were then proposed to the professionals who agreed with them, but also gave kind of evidence-based ideas on how or what this could look like. Also, parents felt that it would be really helpful to have emotional support, as this can help manage their stress and anxiety, and then help them to be able to support their child and to feel connected to other parents. So this was particularly in the in-person workshop. You could almost start to see this happen. So parents, as they were discussing ideas, were sharing strategies that had worked for them, and that emotional support even started to come out them. And this in turn will hopefully make them feel empowered and confident in supporting their child. In the regard between the indirect relationship between parent and school, so we thought originally from that kind of phase 1 and 2 findings that it'd be helpful to support the parent and school relationship, but understanding that it's a tricky thing to do in that we will be supporting parents, so we're not working with schools here. But parents did really feel that it would help, again, that sense of empowerment if they understood the statutory context of attendance and had strategic tools to help them communicate with school, and this would build their confidence to approach the school, as many parents worried about even going to school and letting them know that they needed help. And it was also suggested by the parents that this might be helped further by sources of mediation. So how this intervention would be delivered, parents felt that a group-based peer support would work best in person, although it was recognised it could be more practically easier online. But what was most important is there are opportunities to connect and learn from other parents. So needing to be time to get to know each other. It was also really important for parents that it was accessible and manageable. So this mainly involved around perhaps childcare, but also having small home learning tasks that they could achieve amongst the busyness of family life. So professionals gave ideas of what these home learning tasks could be, whether they could be role play or little activities. They particularly, professionals suggested making sure that it wasn't heavy on writing, so perhaps having videos to watch. Also, parents felt that it'd be helpful to have that one focal point of resources and perhaps an evolving source of resources. And it was also discussed, and it was very important for the workshops to be, for the intervention to be interactive and engaging. So a workshop style was suggested, and having activities and learnings from professionals and parents. And one parent suggested involving children in home-based tasks, and this was seen really positively by the other parents as well. And the professionals were able to give examples of different interventions that kind of had this workshop style that we will look further at. Now, the question that still leaves is quite unanswered is who would deliver this intervention. So parents discussed positive experiences of a good group facilitator, and also gave examples of facilitators that weren't that helpful and kind of what made them unhelpful. And here are some examples of what's really important to them. And the thing that was said by most often, or was really important, was empathy and being a good listener and being organised. So having that person who's leading the discussion but is flexible and listening to the parents' experiences, and having that flexibility, but also that knowledge to be able to respond and give practical, useful advice. So the professionals then gave some ideas of what services could provide this, but it's not quite clear on where this will sit. And I think this is something that will be made clearer as we develop the intervention further and have a more concrete example of what the intervention will be and what it will look like. So the feedback from the stakeholders was consistent with an applied ecological systems model of school attendance problems, so highlighting that there's factors that we need to be addressing that's across environmental, family and individual child domains. So stakeholders endorsed strategies to improve parent-school communication and better understand statutory requirements around attendance. Strategies were also recommended to help parents effectively respond to a child's anxiety, distress about school through perhaps cognitive behavioural techniques or other evidence-based techniques that professionals were able to share. In terms of intervention providers, stakeholders pointed to the need for knowledgeable and impartial facilitators with scope for parents to obtain group-based peer support. Additionally, stakeholders advocated for in-person delivery that is accessible and manageable, with additional supportive resources such as a website and a workbook. Also, value was given to providing the intervention at the early stage or inset of school attendance problems. So the next steps will be to consider creating an intervention blueprint and materials, and this will be continued with co-design. So we'll be using all of these ideas to develop a more concrete intervention, but continuing to get feedback from parents and professionals as it evolves. So if you'd like to discuss this intervention development further, then please do contact me. I've put my email address there, and any further questions about the intervention or about, I've only really briefly mentioned the interviews and surveys, and I haven't talked about the findings from that. But if you wanted to discuss that further, then do contact me. Otherwise, thank you for listening.